everyone, Dr. Charlie Johnson, physical therapist. I want to take a quick moment to talk to you about the link between back pain, x-rays, and MRIs, okay? And the way I want to kind of teach this is I want to propose a question, right? So first things first. So blank percentage, okay, I'm looking for a percentage here. Blank percentage of people over the age of 50 have spinal stenosis or degenerative disc disease, that's DDD, and feel absolutely no pain, all right? The next thing, blank percentage of people over the age of 50 have a herniated disc and feel no pain. Give you a second to think about that. Now, would you believe me if I told you that 80% of people over the age of 50 have spinal stenosis, degenerative disc disease, or arthritis in their spine and feel no pain, and 60% of people over the age of 50 have a herniated disc and don't even feel it. That is, they feel no pain, okay? Pretty crazy, and you might be wondering, like, how the heck is that possible? And I'm going to explain how that is, okay? So the first thing you need to understand to get this concept is that pain is an experience. I'm going to kind of underline that word, okay? Pain is an experience created by the brain to protect you from some perceived threat or danger. So without your brain, you don't feel any pain. Now, you're not crazy. Pain is a very real thing. But here's what happens, okay? And here's why we see very little correlation between x-rays and MRIs and what people actually feel. So a lot of people give a lot of credit to the fact they've been told they have bulging discs or degenerative disc disease or their spine is crushing or compressing or something like that based off what they've been told from some of the images they've had. And the truth is that you're probably giving it more credit than it's worth. So this should actually make you feel hopeful and kind of good about the fact that there isn't a clear correlation between what we find on imaging and what you may be feeling or what people feel in general, okay? Because a lot of healthy people have ugly things on their x-rays and MRIs and feel no pain. So here's what's happening. How can somebody have ugly stuff and feel okay? Remember, I said pain is an experience created by the brain. So on this part of the scale, we've got pain, and down here we've got time, okay? And what we see at any given point, there's 400 nerves in the body, 45 miles of nerves, just buzzing around, waiting to get slapped, okay? Up here, we have a pain threshold. I'm not going to argue if you have a pain threshold, a high one, a low one. To some degree, you have a pain threshold. That's up here, right? Now, let's think about this. So 400 nerves in the body, 45 miles of nerves. Let's think about a time that you had a paper cut or maybe you stubbed your toe, all right? So what happened? Well, you had a paper cut, you stubbed your toe. What did you say? Ouch. If you've seen on YouTube, ouch, Charlie, that really hurts, okay? So that really hurts, right? So now, what happens after a couple days? You have that paper cut, you stubbed your toe. What does it feel like after maybe a couple minutes, a couple hours, definitely a couple days? What happens? Probably what you're going to say is that it calms back down, right? It goes away, it heals, and you feel okay. So the pain kind of goes back down. Your nervous system is happy and just buzzing along. So think of this kind of graph as like your alarm system. So pain is sort of like your alarm system, and pain is an experience, okay? And we'll talk about that. So stubbed your toe, went back up, you said ouch, and then it kind of calmed back down, right? So, take an incident where maybe you bent over, you picked something up, you took a long car drive and your back hurt, you twisted, whatever. Think about the time when your back pain began. Well, your back pain went up, right? You did something, you said ouch, that really hurt, okay? Now, what happened after a couple days? Well, did it ever go back down? The answer might be no, because you're watching this video and you still have back pain. Now let me ask you something. If you gave yourself a paper cut and you still had that paper cut, I don't know, for 6 months or so, 6 months later you still had, pain in your finger or a cut, say that you had it for 6 years, so you still look down and you had that paper cut, how would that make you feel? Your answer is probably, well, that's weird, right? That shouldn't happen, because I know that when I give a paper cut, or when I get a paper cut, hopefully you're not giving paper cuts, you look at it and it just heals naturally, right? So that would be really concerning and weird if it lasted for more than just maybe, a couple days, right? So the question then to you is, what makes your back any different, right? So what I mean by that is that your back is just a tissue. Right? So it should heal. And what we know, because we have evidence of this, is that you can take one image of somebody who herniates a disc and then you can go 3 to 6 months later and actually take the same image of somebody who's gone through physical therapy or conservative treatment, okay, and their back, their herniated disc is gone. It heals, okay. So your back pain at some point got bad. You said, ouch, and it never, your alarm system sort of never reset. So then at some point you could do all this activity before you felt any pain, and now you're at a point where you have very little room to do things. So your life is kind of narrowing in. So really interesting, right? So we've got pain as an experience. So how does that happen that it just doesn't heal? If it's like every other tissue, why doesn't it calm back down? Pain is an experience created by the brain. So one explanation could be that sort of like your paper cut, you keep just nicking it, right? If you have a paper cut on your knuckle and you keep bending that knuckle, well, it's just going to keep kind of cracking open, right? Same thing goes if you have back pain. If you have back pain and every time you bend a certain way, your back continues, you re-aggravate things, or you annoy some tissue in your back, a disc, arthritis, whatever, all right? It could just be that as soon as you start to feel better, you continue to irritate it. So that keeps kind of the alarm system on alert, right? But now we're, that could be one reason, but now we're years out, right? The other thing that could be causing it to kind of stay on alert or on high alert is that when you have back pain, how do you feel? Well, you're probably not going to say good, so you feel kind of bad and a little bit stressed out. So when you're stressed out, you release cortisol, which is a stress hormone, and causes a stress response or a kind of fight or flight response within the body. It heightens your awareness to things, right? And then when you're stressed out, you don't feel great about life. Let's just say, when you're at work and your boss is on you to get something done, how do you feel? Not well, right? When your kids ask you, hey, Dad, or hey, Mom, can you come and, play outside? And you say, no, son, my back's really bothering me. How do you feel? Not very good. When you don't feel very good, how do you sleep? When you don't sleep very well, you don't perform well, right? And then, put this on top. You have all these things, right? And then you go to a physician, you get an x-ray or an MRI, and they tell you, you have the back of a 70-year-old. Your back looks terrible. You have disc degeneration. Your spine's really ugly. I'm not sure what we can do for you. It doesn't look good. How does that make you feel? Not good, and probably a little afraid, right? So point being is that we have all these different experiences, right, that prevent us from sort of forgetting about our back pain, right? So I used this example when I was speaking with someone yesterday. Imagine you're on the boardwalk, so one of the things I do is, like, if I'm going to remember anything in life, create some crazy experience about that, whether you're just trying to remember a few words or, in this example, think about a time maybe you just went to the beach, okay, and perhaps, maybe this happened to you, and you'd never forget this, right? Let's just say some guy ran up to you, smashed an ice cream cone over your head, slammed some flippers on you, and then threw you in the water and made you flop around, right? So, I don't know, I think that's funny. You would never forget that experience. I don't care how old you were, where you went, where you traveled, who you met. You would always be able to point back to where you were, what you were doing, and the man who smashed the ice cream cone in your head. So the point is that through a heightened experience, you have a greater memory. Sort of the same thing with back pain. Yes, you're irritating some tissue, that's the reason, but you're stressed out. Now you remember that you couldn't go to your son's baseball game. Now you remember that you weren't sleeping well and maybe you lost your job because you couldn't make it to work because it hurt. And you definitely remember that physician who told you that you had the back of a 70-year-old. Okay, so point is that this is what keeps back pain going. What you have to understand is that pain is an experience created by the brain to protect you from some perceived threat or danger. It doesn't mean pain is not real, just there are a lot of things going into it. So when we treat people with back pain, we have to think of all those things. So pain, pain is like the wind, okay? You can feel it, but you cannot see it. So you cannot take a picture of someone's back and just, kind of put that over their head and say, oh, this is what we saw in the image, this is what you have going on. Classic example is when I worked in California, I worked alongside some of the greatest spine surgeons. I'll never forget it. I walked in, shook the surgeon's hand, and he said, Charlie, we have a great case. Come over here to the computer. He looked at the computer, and what he saw was that this person had a massive disc herniation, okay? And the disc herniation was on the left side, and he said, Charlie, this person's going to have really bad pain, numbness, or tingling down the left leg. So he said, let's go in. So I walked behind him. I didn't say anything. And, he introduced himself to the patient, and he said, hey, Mrs. So-and-so, how's your left leg? Because that's where the disc herniation was. The lady looked at him, and she said, well, Dr. So-and-so, I don't have any pain in my left leg. It's in my right leg. Okay, so pretty crazy experience. It was sort of like a light bulb for me. In that what we see a lot of times is that the imaging does not correlate to what people are feeling. So you have to put the whole piece of the puzzle together in order to get the best treatment for that person, and in this case you, if you have lower back pain. So if you have any questions, comment below. My email is charliejohnsondpt@gmail.com. I'd love to hear from you and hear your back pain story, or give me a call directly at 484-552-3767. So hope this helps.